Welcome to Adapt and Class. Critical care nursing exams is very interesting exams, and one of the areas that bother most students is the cardiology aspect. If you're planning to take your exams and you're practicing, I want you to watch these videos. It's a series I'm doing, trying to help you on the cardiology aspect of it. These are very interesting questions, difficult, but require critical thinking. Stick around. Let me show you 3 questions, very high yield. You're most likely to get in your exams. The first one is based on content I already reviewed with you. There's a video on what the PA catheter or the portion, what it means, and how you to use questions to find what is the right answer based on those content, right? So you have to know what the PA catheter is. So how do you analyze these questions? Usually they'll give you a long question. Don't worry, don't freak out. Just look at it. You can analyze it quickly and you can figure out the buzzword and you can answer the question. Which of the following is the most appropriate next step? That means the most, all of this is okay, but there has to be most appropriate. Number one, what is the issue? A 68-year-old male in the ICU is being monitored with the what? A PA catheter, pulmonary artery catheter. He is intubated and receiving what? Norepinephrine. We use the pulmonary artery catheter for fluid status. So he's getting what? Norepinephrine to help the blood pressure, most likely for hypotension. Current hemodynamic data. The video I made, it talks about all the hemodynamic data and what each values means. His central venous pressure is 4. His pulmonary artery occlusion pressure, which is the same as wedge, is 5. His cardiac output is 2.6. His systemic vascular resistance is 1600. Blood pressure 82/50 and heart rate of 112. All of this is telling you something. If you don't know, like I said, check those videos. Let's get through it and let's figure it out. CVP is too low. 4 is too low. His wedge is also low. That should give you a clue. His cardiac output is also low. Systemic vascular resistance is high, very high. His blood pressure is low. His heart rate is what? High. There's a reason why he's doing that. And let me give you the strategy. Low CVP plus your wedge pressure, PAOP. If you see that, it means there's low preload and low perfusion. So this is hypovolemia. So his blood pressure, that's why his blood pressure is low. It's hypovolemic. His cardiac output is also low. His SVR is high. This indicates vasoconstriction. When you know your ejection fraction or cardiac output is low, your systemic vascular resistance will increase to increase what? Your blood pressure. So we have vasoconstriction to compensate the low what? Cardiac output so that I can improve your blood pressure, right? And then the patient is hypotensive and tachycardia. It tells you patient is in shock. Shock, low cardiac output, vasoconstriction, low preload. This is telling you I am what? Fluid down. That means fluid depleted, hypotensive, and low perfusion. This is how the P is. So because of that, all these numbers means patient is in shock, hypoperfusion, and needs some fluid. That's all because the cardiac output is low, CVP is low, systemic vascular resistance is high, blood pressure is low, and tachycardia. Therefore, we're going to give the patient fluid. If we increase norepinephrine, it's already maxed out. It's receiving it. It's not going to help you. It's going to cause more vasoconstriction. And therefore, your SVR will go up. Your cardiac output will remain low because you need fluid. Start Marinol is going to dilate and even worsen the hypotension. It causes venodilation. If you give them furosemide, they're going to lose water. And what will happen? More tachycardia, more increase in SVR, and more decrease in your cardiac output. So these patients need IV fluid. This is the way I want you to analyze those questions. So number 1 is your right answer. The next question is based on the same thing. What does the pulmonary artery catheter most accurately reflect after inflating the balloon? That means the PA catheter, when you blow it up. A 79-year-old male with the history, usually it will give you a long case. Don't worry, sit back, analyze it. He's a 79-year-old male. Okay, he has history of left-sided heart failure. So his left side heart failure is in trouble, right? And then diabetes and medication non-compliance. So he has not been taking his medication, present for what? Follow-up. He denied carrying symptoms. He said, I'm fine. The temperature is okay. His heart rate is okay. His blood pressure is okay. Basically, all the numbers look fine. Saturation is fine. On the physical exams, he revealed what? Trace late inspiration crackles. So there's something in the lung, in the bilateral lower lobes. There's some fluid in the lung bases, right? Diuretic was prescribed to help with this fluid, and the pulmonary artery catheter is placed to assess its preload. What does the pulmonary artery catheter most accurately reflect when you inflate the balloon? This is how the pulmonary artery catheter works. So did they go through your vein in your groin, most likely, and through the groin, they go into the what? The right atrium of your heart, and they go down to right ventricle, and then they go into the pulmonary artery, and then they go into isolated portion. They isolated a small portion in the pulmonary artery, and then they blow the balloon. When they are in the pulmonary artery, before they blow the balloon, the pressure you're going to get is the pulmonary artery pressure. When you blow the balloon, you are most likely occluding. So pulmonary artery occlusion pressure. This is giving you the capillary pressure, which is the wedge pressure. What do you reflect when you occlude here? All the pressure is reflecting the left atrial pressure. So the left atrial pressure, this is what happens when you blow the balloon. Therefore, this is the right answer. Right ventricular systolic pressure, it deals with what? The pressure in the right ventricle has to push again. So it depends on pulmonary artery pressure and how the pressure is regenerating the right ventricle to push blood into the pulmonary artery. Left ventricular systolic pressure is the pressure in the aorta that the left ventricle has to push against. Therefore, 2 is the right answer. What does he reflect? Because he has a heart failure, left-sided heart failure, he may have severe heart failure that blood is backing up into the left atrium. And so the value that you get will tell you left atrial pressures. And then, or if you have a mitral valve stenosis, you increase the left atrial pressure and your wedge pressure will goes up. So when you blow the balloon, you're checking the left atrial pressure. That's the content regarding that. The next question is the same catheter we're dealing with. A 77-year-old woman undergo transcatheter aortic valve replacement, right? For severe aortic stenosis. So if this is the heart, the aortic valve is just connect the ventricle. So the left ventricle pump blood through the aorta, basically. And there is a stenosis here, and the valve is replaced. Hours later, how did they do it? Transcatheter, same thing. They go into your groin and they go all the way down to this to fix it, right? What is the problem? Hours later, the client developed what? Left arm weakness and slurred speech. So slurred speech, left arm weakness. Vitals normal, EKG normal, and chest X-ray confirm proper placement of the valve. So the valve has not ruptured. Yeah, nothing has happened to it. It's in the right place. You see, I'm trying to analyze the question so that you can be comfortable when you're doing that. You too, you need to analyze it and say, okay, this is what is happening. And now when aortic valve replacement, right, transcatheter one, then all of a sudden I have left arm weakness and slurred speech. Something bad is happening. Is the valve ruptured? Is it leaking? But the churches will look fine. The valve is in the right place. Your lung is fine. So nothing wrong with your lung and your pulse are intact. Patient is stable. Vitals is stable. What is the most likely cause? Transit ischemic stroke is acute onset. It's like transit ischemic attack is acute onset. It's like having stroke, but it's not. It resolves within a minute. Very short. It's a warning sign. It cannot be this, right? Patient has what? Left arm weakness and slurred speech. There's nothing in the question telling you this was resolved. Valvular leak. That means the valve basically start leaking, is not holding on to its pressures, so it's leaking. This will lead to murmur. You have different heart murmur, right? There's nothing in the question telling you I have a new heart murmur that I have to worry about. Hypoperfusion related encephalopathy. Encephalopathy, you know, there's a global neurological problem. Patient will be confused. He will be having hysteresis. He will have all the things associated with encephalopathy. There's nothing in the question telling you. The good perfusion, his vital signs is fine. There's nothing that you need to worry. His pulses are intact. That means he's getting perfusion. What is happening is emboli, cholesterol emboli, or clot from the procedure through the groin went into the brain, and the patient have stroke. So this is your right answer. These are hard questions. They're designed to test your knowledge, adapt, and get you back. If you need more, subscribe to our channel or watch this series. It's a series, a playlist. Click on the playlist. I'll put it in the description, and you click on it. You get more content like that. Take care of yourself, and good luck.